Substance use disorders, like opioid use disorder, are real health conditions, and the words we use to talk about them make a big impact. Certain terms convey judgment and continue the idea that it's not okay to talk about these conditions. We want to encourage teens to seek help when they need it, and this can start with using neutral terms instead of judgmental ones. Even though this topic may be scary and uncomfortable, it is important to become familiar and comfortable with these terms. We want to normalize, not demonize. Opioid misuse means taking opioid substances not prescribed for you or taking differently than prescribed. Chemical dependency means a pattern of using a substance that causes significant problems or distress to affect daily life, relationships, performance at school or work, etc. Opioid use disorder is an official diagnosis for clinical-level opioid misuse, ranked as mild, moderate, or severe. This diagnosis includes long-term brain circuit changes even when the substance is not in the body, lowered control and social functioning, and taking increased risks to use. The specific symptoms can vary from person to person and based on the substance, but can include low mood, nausea, muscle aches, dilated pupils, diarrhea, fever, sweating, and trouble sleeping. Tolerance is a need for increased amounts of a substance to achieve desired effect or less effect from the same amount over time. Withdrawal means several physical and/or emotional symptoms due to reduced or stopped substance use. Relapse is a recurrence of problematic substance use after being in recovery. Recovery means improved physical, mental, and social well-being and health after experiencing a substance use disorder. Terms to avoid. Addict. A person who struggles to refrain from substance abuse. This term frames the person's chemical dependency struggle as a defining characteristic of who they are. It's better to use person-first language, like persons with a substance use disorder. Also, avoid terms like junkie or druggie. Addiction. Term for being mentally, emotionally, and/or physically dependent on a substance or behavior. Substance-related disorders are no longer called addictions. Abuse. Though substance abuse was previously recognized as a clinical term, it is now referred to as chemical dependency or substance misuse. Clean or dirty, referring to substance test results. It is more appropriate to use terms positive or negative screening to avoid association of substance use with filth and judgment. Now, let us consider how language use affects people in the real world.
2 Cokes for that. You know Brian, the star player from last year? He's benched again tonight. And I think he's going to be cut from the team.
Really? But he had recruiters all over him last year.
Well, I heard that ever since he twisted his knee at the sectional game last year, he's become a total junkie. My son says that he's like a totally different person now. Barely makes it to practice, and when he does, it's like the light's on but no one's home.
Yeah, and our daughter Tanya said she saw him counting a big bag of pills at his locker one day and then offered them to his friends, right out in the open. Can you believe that? I told her that she and her friends need to stay far away from Brian.
Such a shame to see a kid turn into an addict. Maybe I should tell my boys to steer clear of him too.
In this scenario, we heard parents talking about a teen likely struggling with opioid misuse after a sports injury. Yet they talked about Brian's struggle as though it was something shameful with the potential to contaminate their kids, instead of a valid health condition in need of treatment. How do you think this might affect Brian's chances to recover? How do you think this attitude might affect his parents? Let us see this scenario again, but with someone speaking up about the tone.
2 Cokes for that. You know Brian, the star player from last year? He's benched again tonight. and I think he's going to be cut from the team.
Really? But he had recruiters all over him last year.
Well, I heard that ever since he twisted his knee at the sectional game last year, he's become a total junkie. My son says that he's like a totally different person now. Barely makes it to practice, and when he does, it's like the lights on but no one's home.
Yeah, and our daughter Tanya said she saw him counting a big bag of pills at his locker one day and then offered him to his friends right out in the open. Can you believe that?
Such a shame to see a kid turn into an addict. Maybe I need to tell my boys to stay clear of him.
Whoa, okay. A junkie? I mean, that's a little harsh, don't you think? I mean, what if that was one of our kids? And I can't imagine that making him an outcast is going to make him feel better. There's something wrong.
Oh, there's definitely something wrong with that kid.
That's why I told our daughter and her friends to stay far away from Brian.
What I mean is that it sounds like he needs help. Does Coach Taylor know what's going on? Has anyone told his parents, Bob and Susie? If it was my son, I'd want to know. And I definitely want all the support that I could get. I'm going to find them, and I'm going to tell them about the counseling center that we took Tim to. Just to support.
That's a good point. I hadn't thought of that before.
In this second scenario, we heard one parent change the conversation direction, which might lead to Brian having a better chance to get help. By speaking up and not treating it like something shameful, these parents can show Brian's loved ones that they have help and support. Through this module, you have learned the terms to use and not use when talking about substance use, neutral language over judgmental words. Please click to the next video to learn more about what opioid misuse can look like.